Hello and welcome back to my channel. If you're new here, drop your name in the comments. I would love to say hello. I'm Colleen. I am the owner-operator of Serene Primary Care, a direct patient care clinic located in Bellevue, Washington. Today we are going to be talking about women's midlife health and sexually transmitted infections. And the reason we're talking about this is because women and humans in general are sexual beings, and that stays with us throughout our lifespan. So even when there are challenges, we still want to have that connection with other human beings. But sexually transmitted infections don't stop occurring just because we get older. So let's talk about who should be getting screened regularly and what you should be watching for. If you are under 45, the human papilloma virus vaccine, the HPV vaccine, is now available to you. It is a 3-shot series and it protects against 9 variants of the HPV virus. Now, the HPV virus, there's a lot of them. There's about 170, and it's a pretty persistent little bugger, and it is what causes warts, right? So warts on our hands, warts on our feet, warts in our vagina, warts on penises. It causes warts. Now, what the HPV vaccine protects against are the HPV variants that cause cancer. It is recommended both for men and for women because men can get penile cancer or anal cancer from the HPV vaccine. Women are aware of cervical cancer mainly because we have been screened since we were very young. But now, if you're under 45, you can get vaccinated, which does lower your risk of obtaining the HPV virus strains that cause cancer. So a vaccine that prevents cancer, which is pretty cool. So then let's talk about sexually transmitted infections that we can treat. So the ones that we can treat and generally treat to cure are going to include the gonorrhea, chlamydia, and syphilis. So those are typically treated with antibiotics. Women often do not have symptoms because, we have our vaginas are internal, and so we don't necessarily see the changes when they occur. So I generally recommend that you do a screening if you're sexually active, if you have more than one partner, perhaps as frequently as every 3 to 6 months. Maybe just you only have new partners every year, but if you are having new partners, get screened. And you can do a self-swab, which is just a swab of the vagina, and then they'll check out whether or not you have chlamydia or gonorrhea with the swab. We also use swabs when we're checking for yeast infections or bacterial vaginosis in women, and yeast and bacterial vaginosis are not considered sexually transmitted infections unless you are a female-to-female couple, in which case we can pass the bacterial vaginosis back and forth, in which case it would be important to treat both of you when that occurs. So you can also get some of these infections through sharing sex toys as well, so that's something to keep in mind. Let's see what else is out there. Trick is the other one, and trick is kind of a funny little protozoan that spins and that we look for it underneath the microscope, also can be treated. Now let's talk about the sexually transmitted infections that don't go away. So once we have them, we have them. So that's going to include our human papillomavirus, which we talked about earlier on the video. It includes the herpes simplex virus. So most of us are aware of herpes simplex virus when we see cold sores, but you can also get herpes simplex virus in the genital area. It's passed by skin to skin contact. So while using condoms does help prevent it, it's not a guarantee that it doesn't pass. Now, the herpes simplex virus people can be, we call it seropositive, meaning we do a blood draw and we look, do you have herpes simplex 1 or herpes simplex 2, and we're looking for antibodies. Now, if you've never had an outbreak, there's some debate as to whether or not you should actually ever get your blood work done for your HSV. because the herpes simplex virus is in communities. There are some data points that say as many as 80% of sexually active adults have herpes simplex virus. I hear it's actually going down, which is good news. And part of that is because we use antivirals. So the antivirals don't cure us of herpes simplex virus. It simply suppresses the outbreaks. So if you are somebody who gets cold sores, you may be familiar with this, that you take your acyclovir or valacyclovir. When you start to get that little tingling and you know it's coming up, you're going to take your antiviral, and that suppresses the viral outbreak. Sometimes it means that we get less, our outbreak is not as long, or it doesn't flare up quite as much. It's not as apparent. Some people have to take their antivirals all the time. This is common for women during pregnancy because we don't want to pass the herpes simplex virus to the newborn as it passes through the vaginal canal. Some people have a partner who's never had herpes simplex virus, and they do, and so in order to prevent spreading the herpes simplex virus to their partner, they will take their antivirals every day, and that does work to help decrease the risk of spreading those herpes simplex virus. So that's another very common sexually transmitted infection that is out in the world. Let's see, the other would be the HIV, or the human oh my goodness, I grew up in the 80s. I should know what that stands for. But it is the HIV is what is kind of the precursor to AIDS. So we have come so far since the 1980s with our treatment of HIV, and it is really, it's phenomenal. It is quite a blessing that we are able to suppress viral loads for people. So many people have kind of normal or typical relationships, and they keep their viral loads down, and the HIV doesn't transmit to their partners, which is really good news. We have longer survival rates. People are living typical lifespans now with HIV. This is such good news, especially if you grew up in the 80s and lived through kind of the deaths of so many of our beloved humans to HIV and AIDS. So that is why it's important to get screened, to help kind of suppress that virus and to kind of keep you healthy for a long time. Generally, again, people are getting screened with blood draws, although there are some clinics that will do it with a mouth swab. So check out what's available to you in your area. If you have any questions about sexually transmitted infections, you can drop your questions in the comments below. I'll also include my website, and you can reach out to me there as well. So have a great rest of your day, and I'll see you on the next one.